thinking about my participation in the Health Policy Research Scholars Program, I found it to be an extremely transformative and really just inspiring program to have been able to participate in. Thinking about all the coursework and kind of just sessions that we had, there was one specific example that, um, you know, learning what we were learning and understanding kind of who we are as humans, let alone as scholars, has shaped my understanding of, um, what leadership means and how we can actually lead from our own individual stories and backgrounds and histories, and really to not shy away from that and being our whole human selves. And I really come to appreciate that. And it's really shaped how I start to kind of lead now, with other groups of people that I work with and organizations and communities, and really to understand that we come to this work as a whole human being, and that all of these parts are extremely important, whether we're in research or in academia or doing community work. But how do we bring our full selves to our work and also uplift everyone else's full story and humanity in our projects? And so that's kind of one big area of learning and growth that I've had through the Health Policy Research Scholars Program. And I am so grateful for that opportunity to have grown as a human, become better in my work and just in my own humanity, and also taking this out to the world as well. A piece of advice I'd have to those just kind of starting and entering this program is really to trust the process. There was times when I felt, why are we doing this? What are we learning? But now today at the other end of this, I wish every single doctoral student had access to this program. It has truly been life-changing and affirming in so many ways, that I wish every student had access to this and could have these experiences and just really be affirmed in who they are as a human, let alone a scholar. And thinking about a vision for a culture of health in my community, I think of a culture of health as a society that we validate our human experiences, that we don't create obstacles for people to have the highest attainable standard of health, and really to have all the tools and resources available to our communities so that they can live long, healthy, and happy lives. And getting there, I recognize, is a challenge, but I do feel hopeful with the changes that we're seeing, with the policies that are being brought forth, that we truly can create a culture of health where everyone's humanity is affirmed